Don't count on being lucky.
Splitting headache. I'm doing fine.
Will we live that long? Who knows? According to my Florida Blue statement. How long will your money last? I almost made a costly mistake. You may be healthy now and figure you can go without health insurance, but listen to our story. For those of you that don't know me, I am Larry. My wife and I sold everything we owned to travel full-time in an RV. That was 4 years ago. Unfortunately, something very unexpected happened, which is the major reason for this video. This is a subject I've wanted to talk about for a while, but I wanted a bit more experience with it first: health coverage and getting sick while traveling. And boy, do I have experience now. If there is any knowledge I wish I had before I started our full-time RV adventure, it is this subject. In a way, I got lucky and I made the right choices about health insurance. Don't count on being lucky. I have a really important story to share with anyone that is around our age, let's say 50 to 65, that is thinking about quitting your job, retire early, and live in an RV and travel to US and Canada like us. Make sure you have some kind of health insurance coverage. Some of you may have coverage from being in the service or retired from a job that offers health insurance during your age gap years before you're eligible for Medicare at age 65. That is awesome, and you are very fortunate. But if you lose your health insurance coverage when you quit working like we did, then you need to get coverage before you take off to travel. Our first year full-time, I still worked and bounced around from Florida State Park to Florida State Park during the winter. I took the summer off of my job for 3 months and decided to travel to Ontario, Canada, where I grew up. During those 3 months, I was able to do this under the Family Medical Leave Act. I did not get paid, but I kept my health insurance coverage. That 3 months off was a test. If I stopped working, would my health improve? Would my rheumatoid arthritis get better? It did. So I get back to Florida in October and went back to work and started working on my plan for departure from work in a few months later in January 2021. I did an entire video about quitting a 30-year career in medical device sales so that we could travel extensively. I will leave a link to that video right up here. The big problem was, what would I do for health insurance? I knew with my health problems, I had rheumatoid arthritis and AFib at the time, I would need to have good health insurance coverage. I didn't know much about Obamacare or the Affordable Care Act, but I had to get educated fast. When I was a medical device sales rep, we as reps hated Obamacare. It was very costly to our industry. But now I needed it. It was really the only option for affordable care. If your income is low while living off of savings like us, then it can be affordable. But there is an upper limit and a lower limit to qualify for coverage. For us as a family of 3, one of our kids was still in college at the time. We had to have an income of at least $22,000, but no more than $37,000 to get the best cost in coverage. We use our YouTube income as our primary income source and then use our 401k to supplement our income to get close to that $22,000 level. No, we don't make close to $22,000 on YouTube. Since we are over 55, the rule of 55 applies, and we can withdraw money from our 401k without any penalty. It is important to manage your money properly. Use savings to keep your income low, but take retirement out to keep it high enough to qualify. If your income is too low, then you fall into Medicaid coverage, which we don't want. This is the most important message of this video. Before you quit your job and travel in an RV full-time, or most of the time, these are the things you need to know about your situation. What is your net worth? How much is in cash, retirement, 401ks, IRAs, things like that? How much income will you have from pensions or Social Security? What assets do you still have in cars, RVs, and houses, things like that? What liabilities do you still have? Credit cards and loans, student loans for your kids. Now estimate what you think your expenses will be while traveling. Then double it. food, insurance, RV payments, truck and car payments, repairs, emergency subscriptions, camping fees, and fun money. Are you still supporting your kids? How much is that going to cost? Make a plan for the next 10 to 20 years. How much do you need to live on? What assets will you sell? When and in what order? How many years do you have until you are eligible for Social Security? What age will you take it? 62, 67, or 70? Have you looked up your Social Security statement and see the estimate of what you'll get at age 62, 67, and 70? We made a spreadsheet that planned out how we will live until our mid-80s. Will we live that long? Who knows? How much money would we spend each month? How much would our money go down or run out? How long will your money last? Are you going to go back to work after finishing traveling? Or are you going to work part-time while traveling? You should know how much money is going to be coming in and how much money is going to be going out for many years in advance. And don't think that you're going to become a big YouTuber and live off of that. That is extremely rare. If you are not awesome about managing finances, get professional help, either an accountant or a certified financial advisor. Now that you have a financial plan, go to Healthcare.gov and fill out an application for coverage under the Affordable Care Act. Open enrollment begins every year November 1st, but you must complete your enrollment by December 15th for coverage beginning January 1st. These plans can keep the cost low because they're subsidized by the government. Do a lot of research before you apply and submit your application. Once you are approved, pick a plan that fits you and your budget. We have a Florida Blue PPO plan because it covers us nationwide, where the HMO plan would only cover us in our home state here in Florida. It's more expensive. Our plan costs $500 a month for Alice and me. You don't have to pick a plan right away. Research all the plans available, pay attention to provider network, deductibles, co-pays, and out-of-pocket maximums. Very important. Make sure you file your taxes on time. It's important to keep your coverage. You may be healthy now and figure you can go without health insurance, but listen to our story. 2 years into our full-time RV journey and 1 year after being on the Affordable Care Act Florida Blue Health Insurance Plan, I got sick, really fast. I spent a month in 2 different hospitals struggling to diagnose what was wrong with me. I eventually was diagnosed with a neuro disease called MOGAD, which has similar symptoms and treatment to multiple sclerosis. The cost for the treatment for the first year in 2022 was over $800,000, according to my Florida Blue statement. If we didn't have good health insurance coverage, we would have been wiped out financially, or not get the treatment that I needed, or both. I have met other RVers our age traveling full-time with absolutely no health insurance coverage at all. They say, try to get blood out of a stone. That is crazy to me considering affordable coverage is available. Don't go uninsured, especially if you have health problems. Healthcare should be a major consideration when planning full-time RVing, quitting your job, or both. I will give details on how I did it, but I am no expert at all. I rely on a rep from Florida Blue to help keep me on my plan. I almost made a costly mistake picking my plan. Having an advisor is very helpful. This will be our 4th year with this same plan. So far, so good. For the last 2 summers traveling to the US and Canada, I have had to fly back to Gainesville, Florida for treatment every 30 to 40 days for a 6-hour infusion of IVIG. It costs over $20,000 per treatment. If I don't get my infusion treatment, I would probably relapse and perhaps even become unable to walk again, or worse. I didn't want to give up on our plans to travel every summer, May to November. Florida is way too hot during the summer months. So I must plan where I will fly from and where I will leave Alice safely in the RV while I'm gone for a few days. It is expensive, $600 to $800 per trip. This past summer, I traveled back 4 times, about every 6 weeks, from Las Vegas, Salt Lake City, Portland, Oregon, and Charlotte. I spread out the treatments to save money on flights. This is one of those costs that we did not have in our original spreadsheet, which is why you need to increase your expense estimate at least 50%. In case you are wondering, there is no way for me to get my treatment on the road in the cities that we travel to. Insurance will not pay for that, and it would be a logistical nightmare to arrange it. If you are planning a full-time RV or even a most of the time RV travel adventure, make sure you have a plan for healthcare coverage. At the very least, get catastrophic coverage. Are you traveling in your RV full-time or most of the time and not employed? How do you get your health insurance coverage? Do you have an ACA plan like us? Please share your story down in the comment section below. Now that we have 4 years of experience as full-time RV travelers, we're going to start sharing more about what we have learned, like in this video. If you are interested in full-time RV traveling, then click the subscribe button so YouTube will recommend our videos more often. If you don't want to miss the next episode, then also hit that notification bell. I will also leave a link to a playlist of RV travel tips right over here. And remember, downsizing does make sense.